don't give up. If you're ever hesitant, then schedule a consult. Some of us out here actually want to do a consult. And so what that consult would entail would just be, what are you dealing with? What kinds of therapy are you interested in? And whether or not we're a good fit.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. Now I have Dr. Prysilla Moreno here of Nurturing Wellness. Dr. Moreno is a naturopathic doctor and licensed acupuncturist practicing in Federal Way, Washington. She's an alumni of the University of Washington, Seattle, and Vassar University. Prior to opening her practice, she was a resident in Seattle where she focused on IV therapy. Her main passion is to help patients feel their best by listening to their whole story and coming up with a plan both she and the patient can agree on. So Dr. Moreno, welcome. Glad to have you here.
Thank you. Glad to be here.
Yeah, so let's just dive right into it. I'm curious, how did you get interested in the wellness space to begin with?
Yeah. So I always wanted to be a doctor, and this was kind of my goal the whole time. I thought I was going to get into research until I met a wonderful mentor of mine who told me about naturopathy. And, coming up with my Latino background, I definitely relied on herbs growing up, and I thought this was a perfect blend of medicine and nature.
Awesome. Now I'm curious, what are some of the most popular treatments that your patients come to you for, and why do you think that they're so popular?
So a lot of my patients usually come to me for gut health as well as hormone therapy. And so that's really where my passion lies, is in the hormone therapy world. I take a little bit of what I know about the IV therapy, and if they want to do that, we'll go down that route. So it's more about regenerative health is what I'm finding. A lot of people just want to age gracefully, and that's perfectly fine. There's nothing wrong with that. And so I help them kind of come up with a plan to feed their gut health so that their skin reflects their inner beauty, as well as focusing on hormone therapy to kind of help with the symptoms of whatever they're dealing with.
Got it. And just to make it simple for people to understand, because I know that when people think of hormone therapy or anything like that, they may or may not have heard of kind of what goes into that. So if you can just kind of make it very simple, like if someone's suffering from X and they come in for hormone therapy, what would that look like in a situation like that for like an average patient for you?
Right. So my average patients usually tend to be a little bit in the older, not the younger children usually. So if it's usually going to be a younger child, it's going to be more acne related. And in that case, we work on really just balancing their hormones. So that'll be more like herbal therapy, nothing too extreme. And if we need to, always bring in like some oral contraceptives if that's the case. If we're looking more into the adulthood, then we're looking at more of the balancing hormones. Same thing with herbs, same thing with oral contraceptives, and then like last minute, maybe doing some replacement therapies, and that's really on the extreme end. And most of my patients usually are relying on the perimenopause or menopausal stage. And so by then we're really working on the symptoms, so like the hot flashes, the night sweats, the fatigue, the weight gain, and all of that stuff. And so we're using a combination of bioidentical hormones and herbal therapy as well.
Got it. Now in this space, I think a lot of people get the impression that it's kind of it's an emerging space. Now, are there any treatments that you're seeing, any new ones that you're particularly excited about?
I think the biggest thing that I'm particularly excited about is the laser therapies. And so with that one, you're definitely seeing a lot of laser coming in, and it's more of the invasive part, because we are putting a laser on your skin, and it is damaging the skin, but hopefully to give the new properties of skin regeneration. So definitely getting that nice collagen bounce back in fullness. So that's one thing that I'm super excited about. The other thing that a lot of people are interested in is the hormone replacement therapy of the pellets. That one is actually a full dose of whatever hormone we decide to agree on, and that is injected right into the gluteal area or the butt area, and that is just released over time, over like 3 months, and we see how patients do then. But laser is really where I want to be at.
Got it. Okay. Now, I want to talk a little bit more about what differentiates your practice from others in the industry. So what would you say is kind of some of those things that really set you apart from the others?
Right. So our practice is a little different because we are a combination of both primary care and our interests. And so here we do a lot of injections and IV therapy, as well as the primary care. So if you need your wellness exam, if you need your, medication refills, we're going to do that too. But yeah, I think that's really different in our sense because where we're located, there's not many of us. Most of them tend to be about an hour or two away. And for a lot of people, that's just, not realistic.
Yeah, okay, I get that. Now, I want to talk about supplements. This is one thing that we were kind of talking about before the show, was that in some cases, supplements are used on a very, maybe not inconsistent, but a very, not in a great way. So could you talk a little bit more about supplements, like what you recommend to your patients, what people are doing wrong with supplements that they maybe don't know? They think it's good, but it's not good. So can you talk a little bit more about that?
Yeah, of course. So with supplements, I definitely tell my patients that, there's nothing wrong with listening to other people. However, I would like to know which supplements they're taking, because oftentimes a lot of people don't realize that some of the supplements are not safe for particular patients. So if you're dealing with hypertension, I'm going to tell you to, back away from licorice. If you're dealing with depression and you're on an SSRI, for example, I'm going to tell you to stay away from St. John's wort. Or 5-HTP, which is another really popular one that people like to be on for mood. And, it's just not a good idea to combine those two. So in those cases, I would really like to know what supplements you're on, because it matters. And the other thing that I notice is that oftentimes I get a lot of patients who, follow certain people, which is fine, but they're often not taking the therapeutic dose of certain herbs or supplements. And so really when they come to me and they're like, I've tried X, Y, and Z, and I ask them about their dosage, they're not dosing it right. And so a lot of times they're on the right item or, herb, but they're not on the right dose. And so they're not going to notice a difference. And they're going to say, oh, well, herbs don't work. Well, that's not necessarily true. If you take the right dose and for the recommended period of time, you will notice a difference.
Okay, got it. Yeah, because I know there's a lot of misinformation out there. People say that, oh, you just take all these supplements and you'll be fine. But then they just, like you mentioned, they hear from one person or another and they're not quite sure of what to do, or they think they know what they're doing, but it's actually not helping them in the long run.
Right.
Now, when it comes to, I want to understand a little bit more about how you approach educating your patients about the services you offer and the benefits. I'm sure you get some people coming in and they're looking for a natural way to get better, but they really have no idea of this entirely different set of medicine, or they probably even have misconceptions about it. So how do you approach educating your patients on what you can do for them and what the benefits are?
Yeah. So that really depends. And that's a loaded question as well, because it depends on what state you're in. And here in Washington, I am considered a primary care provider. So that means that I have a lot more freedom in what I can offer patients versus in a state like California, we're not considered primary care, and we're more adjunctive care therapies, and so we're not allowed to interpret labs. And in other states where you're not licensed, well, now you're kind of working more as an advisor. You're still unable to recommend things medically, but you can recommend that a patient, ask their provider certain things. So that's where I like to differentiate that for patients, because I do get some patients that recently moved to Washington State and they had never heard of naturopathy. And there's others that have always, grown up and done herbs as medicine. And so really where I like to tell the patients is that I am a doctor in Washington State, and we are allowed to order labs, order imaging, and prescribe medications if needed, with the caveat that there are some medications we're not able to prescribe in Washington. And so I explained that to them, definitely what I can and can't do. And then we go from there. I also want to mention that we are in Washington State, since we are considered naturopathic doctors, we are physicians. So that if you do find someone that calls himself a naturopath, be very careful in what you're getting into, because naturopath is not a licensed, name. And so you are allowed to be a naturopath. But in that case, that means that they were not a naturopathic doctor. They did not receive that license nor that education. And so, just be very wary of, where your provider comes from is all I can say.
Okay, got it. So where did that actual name come from? Like the naturopath, the ones that are not the doctors? Like, was it just like a term, like almost slang that came up and they're trying to pass themselves off as the doctors, or where did that really originate from? Do you know?
Right. No, I do not know, but I do know that naturopaths has been around for a while, that term. And really, as we started to get, licensed and regulated, we really started to differentiate ourselves. And so that's why we always tell people, where our education is from. And there are only, I want to say 5 now naturopathic medical schools in the US. And so really, if we come from any of those schools, then you do have a naturopathic doctor versus it's not illegal to say naturopath, and so in that case, really just know that if you go to a naturopath, you're most likely dealing with a person that may have gone to those schools but are in an unlicensed state. So in that case, they're working on that. Or you may be dealing with somebody who's more of a, just like an herbalist. And so in that point, you're really dealing with kind of like a life coach in that sense. And so just definitely question, who your provider is and what education they come with.
Okay. Make sure that they're a doctor as long as their state is in line with that.
Right.
Okay. Got it. Now, I want to dive a little bit deeper down into kind of what makes your type of center, I'll call it a wellness center, different from your traditional doctor's office. Because even like in your case, it seems like you do both sides of it. But I think for a lot of people, they don't really understand what is that difference. Like, can I just go to my doctor and get this information? Like, why go to like a wellness center? So can you explain a little bit more about what that difference is?
Right. So in the conventional world, I will say it depends on where you go. You're often going to see a specialist. I should say that. So oftentimes when you're dealing with regenerative medicine, you might notice that you're more of in a derm place. And in that case, that's where the focus is. So they're going to be focused on the skin and those treatments related to the skin. And then when you're dealing with, our office, for example, we're kind of like a one-stop shop, which is more just like, we're going to deal with you in your annuals. And then we're also going to recommend these other therapies that may be helpful. And so, for example, in Washington State, if you go to your regular provider and they're recommending vitamin B injections, they're going to prescribe you cyanocobalamin, which is usually a vitamin B12 that's, paid for by your insurance. And then you take it at home and you do your dosing there. Versus we offer methylcobalamin, so it's more the active form of vitamin B12, and we're going to do our injections in office. So it's really, I want to say we differ in our approach in that we want to offer everything for you and explain to you the differences in person versus letting you kind of figure it out on your own and kind of wondering if you're doing the right thing or not. And it's that uncertainty that a lot of people don't like because there's not enough time with other providers, and that's where we differ.
Okay. Now, when it comes to the differences as far as the treatments that you provide, I mean, what are the other alternatives that people have? I'm assuming drugs is a really big part of that, but I mean, what else is there for choices for patients? I mean, aside from drugs and I don't even know, maybe surgery in some extreme cases, is there really anything else that they can do aside from the natural treatments that you're providing?
Yeah, so that's usually where I like to rely on all my resources, so my referrals. I like to tell people that there are options. So for example, if someone's dealing with we'll just say a slap tear, so a shoulder injury, it's not a full tear. So it means that maybe they can do surgery if all other therapies that they've tried have not worked. So in that case, since I'm an acupuncturist as well, I'm going to try acupuncture. And in acupuncture, we have a lot of other tools that we can do. So we could do electroacupuncture, cupping, obviously needling, even some injections into the area. That's all, within my scope. And then if none of that's working, then I refer out to physical therapy. And I definitely do my due diligence. So I like to meet one-on-one with a lot of providers, and I like to see what's different about their practice versus other practices. And I myself have had physical therapy, so I know kind of what the patient will experience and how the provider will be different as well. So I love to do that with other providers. If physical therapy is not working, we're going to go a little bit more of the non-conventional route, and that's going to be more of like the cryotherapy. So definitely recommending like the ice water baths, or maybe blood restriction, which is what some physical therapists offer. So, not everyone offers the same thing. And I always tell patients that let's try everything. And then if all fails, then we can talk about surgery. And so we really try a lot of things.
Okay, so pretty much whatever to keep them away from surgery.
Mm-hmm.
Okay.
And that's just one example. Of course,
Yeah.
there's other things that we can do.
Okay, got it. Now, I'm sure that there's a lot of misconceptions about natural healing, natural wellness, or about the treatments you provide. What are some of those common misconceptions that you typically see with your patients?
Right. So I'll a lot of those misconceptions, they have their stories, and I understand where they might have heard them from. But some things that I usually get are, what am I going to do for hypertension, right? And am I following the guidelines? So every provider in Washington State, if you're a physician, you're going to follow certain guidelines. And as long as they're within the safety of those guidelines, then yeah, we can play around with some herbs and supplements and other things, lifestyle. However, if they're in the danger zone of blood pressure, then yeah, I'm going to rely on medication first. And I'm very upfront with the patients. I don't really try anything that might put them in danger. And I think that's where a lot of misconceptions are, is that we're going to do something so extreme that it actually harms a patient. And that's not the case. Instead, we're actually working within their abilities for their body to do what it needs to do. And we adjust from there. So if they do start to respond to their medication and they're doing great with their lifestyle and all is going well, then we can start to reduce medication and incorporate some more herbs. And hopefully a lot of patients want to come off the medications. And if that's all right for that case, then we do that.
Okay, got it. Now, when it comes to medicine, a lot of people think about it's very scientific. You have this process and you have to follow it. But what role would you say does creativity play in your approach to patient care?
So again, for example, let's use a patient who has been on, in this case, diabetic medication for a while, and they're type 2 diabetic. Yeah, we're going to try out some creative stuff. So for example, the go-to is going to be metformin. If you're newly diagnosed type 2 diabetic and you're not terribly off in the A1C, then we're going to do a metformin, and metformin is the go-to. However, if they come to me and they're trying to avoid metformin, then we're going to do some lifestyle stuff. But that's kind of where the creative piece comes in. And so that's going to be more of what I've read on research for, obviously how to treat type 2 diabetes, what I've seen in practice, what the patient can physically do or not do. And together we decide, all right, this is what we're going to come up with and what we're going to try. And we do trials. So we have goals. And that's where I like to just tell people, is that during these goals, we're going to be very specific in what we're targeting. And if we're not reaching those goals, we're going to either incorporate or take away other things. And from there's always basically having a plan A, B, and C. And they're aware of that as well. So definitely different in that sense.
Okay, got it. So it does sound like there's quite a bit of that creativity and really just finding that customized plan that's going to work best for the patient and their situation, sounds like.
Correct.
Now, I'm sure that throughout your experience, you must have run into some challenging cases or some challenging situations with patients. Would you mind sharing a couple of stories about some of the patients that came in? It was really tough, but you were able to find a way to get them a successful outcome.
Right. So there's one case in particular where I had a child. She was about 8 years old. And in that case, constant daily migraines. And for me, that was very new, and I didn't really know where to go from there. So we started at the basics, which is diet, sleep, exercise, all of that. And it turns out that this particular child was eating a lot of products that had gluten in it. And even though they were tested for celiac, it was not the complete panel that I would have done. And that's where we differ. Every provider is different. So not to say there was anything wrong, but it's just something that I would have done differently. And we went from there. So I ordered a complete panel. In the meantime, the patient is trying something that I recommended for gut health, and the mom is on board, definitely telling her my thought process the entire time so that way she could understand why I want to do a repeat blood work and why I wanted her to try this gut health in the meantime while we're waiting for results. And sure enough, the results come back and she is definitely looking like she needs celiac. So why I say that is because we can't truly diagnose celiac disease based off of blood work. Guidelines are going to say that you need to diagnose it off of endoscopy and biopsy. And so in that case, once I saw those results, I definitely referred to a children's hospital and specifically gastroenterology and immunology. And from there, they took it from there. And turns out patient was celiac, and that was contributing to her migraines. So her body was telling a story, and the only thing that she was being offered was round-the-clock Tylenol for the pain.
Wow,
and
that's
it
incredible.
was very sad because she could not enjoy her school.
Oh yeah, it's incredible. I mean, just the misdiagnosis, it's a huge problem in medicine. So I mean, being able to figure that out, get her the help that she needs, I mean, it's just fantastic. I can only imagine what would happen if like she didn't get that right diagnosis and she's just on Tylenol drugs for who knows how long, if they ever would have figured it out.
Yeah, and so that one was really amazing. Both the parents were happy, and I was just glad to at least, help them get to the right person.
Okay, that's great. Do you have another one that comes to mind? Another a story of a challenging case you ran into?
So for challenging, there was one where it was again another child, and in this case, the child was born with black toenails, and it was interesting because I had never seen that, and her whole life just had black toenails, went to dermatology, went to the foot doctor, all of them said that it was fine, she would grow out of it. And the only reason why she finally came to me in her preteens was telling me that she did not like that her gymnastic teammates were now noticing her weird toenails, as she said. And just really just doing a deep dive into birth to now, what was happening. Turns out child had a lot of skin issues growing up, a lot of digestive issues, and these black toenails that have followed her since birth, and they didn't seem to grow, so mom never needed to clip her toenails. So we ended up doing, and this is very out there, and so this is where you'll notice that some conventional doctors and some naturopaths, we just don't agree. So we ended up doing a food sensitivity panel. It's an IgG panel, which means it's not a true allergy, but it is a sensitivity, meaning that the body is responding. And that's what we ended up doing because mom just really wanted to kind of get all the information she needed. And in this case, there were a couple of things that came up on her food sensitivity, and we did a trial. So children are really great at responding to therapies. And in a matter of about 2 to 3 months, her toenails were starting to turn back into their regular normal color that, you would imagine toenails look like. And her skin issues, so in her case, she had some psoriasis, all of that was clearing up. And it was amazing because this is just something that she had dealt with her whole life.
Wow, that's incredible. And it sounds like you get the people who have just almost given up hope on it, and you're able to find a solution for them.
Right. And, again, very honest, we're going to keep digging. If it doesn't work, we're always going to try something else. And as long as the patient, the parent is game for it, we try everything.
Fantastic. Now, I want to get your thoughts as far as the growth of demand for natural treatment. I mean, it seemed like before it was very common to take whatever drugs, get whatever surgery, but it seems like now there's more of a resurgence of getting away from drugs, getting away from surgery, and going through more natural treatments. Is that something you're seeing happen more in your area and kind of across the board?
Right. So I definitely am seeing that. So a lot of patients or potential patients are calling because they are wanting something different. They want to either get off a medication, they want to finally do the lifestyle change they've been putting off. They just need guidance, and that's what we're here for. And so if I can't answer a question, I have a colleague who does. If we're not the right profession, then I refer out to whoever, such as a nutritionist, physical therapist, chiropractor, something like that. So definitely trying to see where we can fit into that world. And a lot of people really appreciate that.
Got it. Now, where do you think the future of natural healing, natural wellness, regenerative medicine, where do you think that's going?
I think it's going in the right direction. So I'm noticing a lot more information being told about magnesium, vitamin D, vitamin C, basically protecting your immune system. And it all comes back to lifestyle factors. So I'm seeing that a lot of people are now recognizing that there is this need to really, get adequate sleep, drink adequate water, and be active as possible. And all of that really does contribute to overall health and well-being.
Got it. Now, Dr. Moreno, I have one last question for you, but before I ask it, I want to point people to your website at www.nurturing-wellness.com. Now, last question is, what would you say is the most important piece of advice you can give to someone who's suffering from something that they haven't been able to resolve? Maybe it's constant pain, it's the headache you mentioned, and they're looking for help, but they're kind of on the fence about whether they should see a natural healing wellness practice like yours. What's the most important piece of advice you can give to someone in that situation?
So it's great that you say that, because I definitely have had people come to me like that, basically last resort. And I hear you, I get it. It's something new. So my one piece of advice would be, don't give up. If you're ever hesitant, then schedule a consult. Some of us out here actually want to do a consult. And so what that consult would entail would just be, what are you dealing with? What kinds of therapy are you interested in? And whether or not we're a good fit. And it's really for the patient to get to see if they are willing to even listen to us. Oftentimes you can tell just in those first few minutes if you're going to mesh well with somebody. And I think that's what really contributes to the patient's overall recovery, because once you feel that you found someone who you might connect with and really listen to, you might be more open to listening to other alternatives. So don't give up. Definitely reach out to anyone in your area and see if there's anything else that can be done. Even if you're in an unlicensed state, reach out to your local naturopath, because oftentimes that you will actually realize that they came from one of the schools that are accredited, and they will be able to offer you some guidance on how to approach your provider and get the results that you're looking for.
Okay, fantastic. Well, Dr. Moreno, thanks for sharing your expertise. Now, where can people contact you in your practice?
Yeah, so I kind of made it easy for everyone. So you can either email me at info@nurturing-wellness.com. You can call the office at 253-237-4704, or you can schedule online. I kind of made it easy. So, if you don't want to talk, you can definitely do it from, your comfort of your home.
Okay, perfect. Well, Dr. Moreno, thanks for sharing your message and for being on the show.
Yeah, thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.